Someone has a defect of cartilage over the weight bearing area of the knee and how it is treated. We will discuss on the management of such defects in this video. So there are different methods of treatment of cartilage. First of all, there is something called microfracture. Microfracture, wherever there is defect, we create multiple holes, and in this hole the new blood clot will form. Blood clot will turn into fibrous tissue which will help in relieving of the pain. However, this is not an exact cartilage material which is formed after the microfracture. The second method is OATS, autologous osteochondral transport system. Means we take the normal cartilage from some other non-weight bearing area and shift it into the defective part of the area. So this is called OATS. This is second step. The third one, autologous chondrocyte implantation. Means we take cartilage, we send this into the lab, they create the cartilage material, make it a paste kind of thing, then they send it back and we fill it on the defect. This is a two-stage procedure. First stage is to be harvesting of the cartilage, second stage will be filling of the defects. So which is one stage solution and which is recent advances is this scaffold system. This scaffold is a material like a sponge or like a gauze which is filled on the defect of the cartilage. When it is filled on the cartilage defects, this will help in creating the stem cells into cartilaginous type of material to grow the cartilage in the area of defect. So this is fixed with the help of bone marrow cells, and this will make these cells are locked between the defect and this scaffold, and the cells will be regenerating into cartilage cells, and these cartilage cells will go on to become a cartilage, and that will help in filling of the defect and getting pain relief for the knee pain. This is one of the recent advances, the cartilage defect. This is a one-stage procedure, and this can be done with the help of arthroscope or also open procedure. If it is reachable through the arthroscope, we can do it with the arthroscope. If it is in an area which cannot be reached through the arthroscope, we can do mini open and fill it. So this is called Hyalofast, and also called as a scaffold for the cartilage defect treatment. If you have liked this video, if you find this is useful for you or some of your friends, please like this, subscribe to my channel, share to your family and friends, and don't forget to subscribe to watch my videos on recent advances of hip, knee and shoulder surgeries and different surgeries of the orthopedics. Thank you.